Good evening. The open meeting law requires that I notify the public that this meeting is recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. With that, I'll turn it over to our board chair, Wesley Ireland.
Hello, everyone. Good evening. I'm happy to be here for our last board meeting of the year. I guess we'll begin with introductions of board members. I'll start with myself. I'm Wes Ireland, and I'm the board chair, and I live in the North End. So I'd like for maybe Olivia, why don't you go ahead and introduce yourself, please?
Sure. My name is Olivia Richard. I am a member of the board and I live in Brighton.
Okay, thanks, Olivia. Charles?
Yes, my name is Carl Richardson. I'm a deafblind individual who lives in Brighton.
Okay, thank you, Carl. Now I'd like, thank you very much, Carl. So, go ahead, Charlie.
Hi, my name is Charlie Kim. I am a resident of the North End and board member.
Okay. Elizabeth? Elizabeth, would you like to go next?
Hi, this is Elizabeth Deanflower. I apologize for the poor audio quality at the moment. I'm on my way home. I live in Copley Square area in Back Bay. I'm a board member and I use a wheelchair. Thank you.
Richard, if you could go next, please.
Hi, everybody. I'm Richard Glevsky. I'm a member of the commission, and I live in Back Bay.
Thank you, Richard. Paul?
Hi, my name is Paul Karen. Please excuse the video difficulties I'm having tonight. I work at the BPDA and serve as the board secretary. Thank you.
Okay. Next, I believe on the phone is, who's on the phone? There's no name identifying the phone caller. Actually, let's also, Andrea, do we have a quorum?
Yes, this is Andrea. We have a quorum with the 7 individuals who have identified themselves. If 206 area code is also a member, then we're +1. But if it's a member of the public, we're still good. We have 7.
Wait a minute, Andrea, how did you come up with 7? This is Carl.
Well, do I need to recount? 1, 2, 3, 4.
No, well, you said a member of the public doesn't count as 7. It has to be.
Right, no, there's someone who called in on their phone, so we don't know if that's
got
a
it.
board member of
Thank
the
you.
public, but even if it's the public,
No,
we have
now
7.
I get it. Thank you, I apologize.
No worries, thanks for clarifying.
So I make a motion to accept the minutes.
I second the motion.
For the interpreter, was that Paul who seconded?
Yes.
Thank you. Okay, so all in favor?
Aye.
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 Yep.
Aye.
Okay. I'd like to recognize Alice Fisher. I'd like to have Alice go ahead and introduce herself, please. Alice, there's no sound. The interpreter cannot hear you.
Am I unmuted now?
Yes.
Now we can hear you.
Okay. Okay, so I'm Alice Fisher. I live in the south end of Boston. My disability is one of mobility from birth. And at various times in my life, I've been quite involved in disability movements, including I was one of the founding members of the Project on Women in Disability, which was a feminist disability. It was back in I think it was in the 70s, but I've got to figure it out. But I'm 81, so I've been around for a while. I started working on the advisory fairly recently, and it's being fun to be there. And the other thing that I'm working on is I'm a community activist, so I do things. And the other thing that I've been working on for about 15 years, and it's kind of coming to fruition now, is a virtual senior center for LGBTQA elders. And by now we've started raising some substantial money from a couple of foundations, and we're kind of moving along. Our name, that project is named Outstanding Life. And if you want to learn a little bit more about it, you can go out outstandinglife.org and you'll find us. And I've done various things throughout my life. Many times involved with disability, but also refugees and immigrants and the LGBTQ community. And I guess I plan to be doing it till I can't do it anymore.
Thank you so much, Alice. I apologize for the miscommunication before. I wanted to have you introduce yourself briefly before we moved ahead with the accepting of the minutes, et cetera. But I think that we've already begun to cover some part of the agenda. But I think that that's okay, that you have the opportunity now to introduce yourself. And now we will move on to the next items on the agenda. What I would like to do is actually want to recognize Lauren. I'd like to recognize Lauren Snyder. And Lauren is she's part of the BEST police organization. So Lauren, you have the floor.
Great, thank you so much. I really appreciate the opportunity to speak with you all. And one of our staff, Kat Sparks, she just joined as well. She's gonna be fielding questions and jumping in to help you guys have a more robust, complete understanding of our program. She is one of the clinicians that works on our team. And I can't remember who lived where, but she works out of the police station in Brighton. So she covers part of the district that's represented in the board here. I'm going to try to share my screen so you guys can follow along in this PowerPoint. Okay. One second. So just in trying to think of how to frame this for you most helpfully, this idea that we should be, as behavioral health providers, partnering with the police so that they can have the best response when behavioral health emergencies arise in the city. We've been doing this work for several years, and it really truly is a partnership. We work very collaboratively. We have a standalone program that dispatches clinicians to behavioral health crises in the community that don't come in through the 911 system. And I think people from our program have come and shared that with you in the past about the BEST team. We're a mobile crisis service for psychiatric emergencies. But because the police are called so often when people aren't sure where else to call, many times calls for behavioral health emergencies come in through 911. And so thought that you all might have interest in learning more about how this partnership works. Chris Morawski joins us monthly for a meeting with our staff to talk about the integration of our clinicians within the police department, and is a really helpful and valued partner. And so I think he has done a good job of helping me understand what would be helpful in an overview, but I look forward to having you all jump in with questions, or hopefully at the end we'll have a little bit of time to discuss any issues that might arise. So for many reasons, police are encountering people with behavioral health issues. And so, by behavioral health issues, I'm including emergencies related to substance use disorder as well as mental health crises. The police terminology for people in a mental health crisis is emotionally disturbed person. So if you hear Kat or I refer to these calls as an EDP call, this is the police lingo that we kind of end up adopting working in their environment for so long. So, for lots of different reasons that the police get called to these kinds of scenes, sometimes by passersby who don't know an individual that appears to be in crisis at all, and then sometimes from family members who are worried about the well-being of their loved one. Statistics at a national level say that about 10 to 20% of police calls have some kind of behavioral health component. But if you survey Boston police officers, their experience of this work is that a much greater proportion of calls has some kind of behavioral health component. So this coding that happens at the beginning when someone calls 911 and describes what the emergency is, 10 to 20% of the people calling in identify the call as having a behavioral health component. But many more times, officers respond to calls that come in with some other classification and then determine that there is a mental health or behavioral health need involved with that call. So perhaps somebody has reported a robbery, and then officers go out and realize that there is additionally, or instead of the reported need of the caller, more of a behavioral health component. So that 10 to 20% is a very low estimate. Just to give you a sense of the scope of the response here in Boston, these are some numbers from 2021. There were over 4,000 calls for service that were coded right at that initial call taking as being for an emotionally disturbed person, and that required a police level response. So some calls that don't seem as volatile might have only Boston EMS dispatched, so an ambulance would go, but no police presence. But in 2021, over 4,000 calls were volatile enough that both police and EMS were required to respond. In that same year, the Boston Emergency Services Team, so our mobile crisis psychiatric service that goes out without police, we fielded 70,000 phone calls to our call center and dispatched out clinicians to respond to people at home and shelters, wherever they might be, almost 18,000 times. And almost all of those occur without police presence on scene. So for the most part, when police interface with individuals in mental health crisis, they have quite a bit of discretion. When we have clinicians who go to calls with officers, we're helping to give them a bit of an assessment of what we believe to be this person's needs and how the mental health system might be able to offer some services to divert this person away from arrest pathways. But sometimes, both things are happening at the same time, where somebody is in a mental health crisis and there is some sort of alleged criminal conduct. And so where there is a tool for officers so that they can exercise this discretion very thoughtfully, but jail diversion is not always an option. Much of the time, I would say in Boston, in my experience and in the majority of our clinicians' experience, we're not really the ones introducing the idea of diverting people coming in contact with the police to treatment. We're often just a helpful tool so that officers are more thoughtfully navigating confusing treatment-related resources, if that makes sense. So officers have been pretty well accustomed to being able to make some preliminary determinations of when somebody's mental health or substance use needs are greater than those in terms of public safety. And historically, the ways that officers tend to interact with people in crisis is to utilize the emergency department. So what we find is that without our intervention, officers are very likely to overutilize Boston EMS and have individuals transported to the emergency department. And we, as a crisis service, tend to only utilize the emergency department for individuals who are likely to need to be hospitalized. The bulk of the mental health system is community-based, and so our clinicians are better versed at navigating those other resources outside of the emergency department. And that's, I think, a great value added that we bring to our partnership with the police. So most often, I would say the police without our intervention are very reliant on Boston EMS to come to the scene and transport that individual to the emergency department. But sometimes officers are just sort of talking with that person and they're asking them to move along, or just sort of addressing at a surface level what's going on with that individual, maybe that specific behavior that led to the 911 call, but not really knowing how else to support that individual in other ways. So they may just have a very brief encounter and then leave that person in place. And then there are certainly people who sometimes get arrested because there needs to be some resolution to that police encounter, and without knowing that there's a larger menu of options, that option may entail the arrest of a greater number of people than if we were able to offer officers on scene a greater scope of options for how to dispose of that police call. So here is some of the other things that we can offer when we have a clinician with the police responding to calls. So part of the mission of the BEST team is to reduce the overutilization of the emergency department. I often share at this point in the presentation that at this point in our lives as adults, we have all probably ended up in the emergency department for an injury of some sort that was maybe on the fence. Maybe you cut your finger, slicing your, Thanksgiving turkey, and you're not sure if you need stitches, and you head to the emergency department and have to wait quite a long time to be seen because there's so many more acute emergencies that are being prioritized over your kind of more marginal need. And when that same kind of thinking is overlaid in a mental health crisis, it can really create disincentive for people to follow through on recommendations that they might receive in an emergency department, if that makes sense. So if the initial contact with providers can be frustrating because it's filled with a long wait in an unfamiliar environment where you're having to wait your turn, even though certainly everyone feels that their problem is urgent when you go to the emergency room. People sometimes leave, feeling disenchanted and are somewhat less likely to then follow through on referrals that might be made. And so by being alongside the clinicians, we're able to navigate these other options. So we through the BEST team, have access to a on-call center that is, the phone number's listed here, 1-800-981-HELP. That number will get you through to our call center where there are clinicians staffing the phone lines 24/7, 365 days a year. And they can start to triage a case and make some determinations around what would be the most helpful response to offer the caller. So we have walk-in urgent care locations where we can see people on site. We can send people into these locations by a cab if they don't have transportation. And through that walk-in location, we're able to address a whole host of psychiatric needs. So we're able to make referrals to outpatient treatment. We're able to provide some psychiatric medication access. We're able to connect people to peer support, so with people with lived experience of mental health or substance use disorders, or family members who have themselves supported their loved ones through struggles with mental health or substance use issues. So all different kinds of services can be put into place by utilizing these urgent care clinics as an alternative to the emergency department. We also like to rely on our mobile crisis clinicians who arrive to people's homes, shelters, et cetera, without the police, because we feel that people are able to best utilize their own coping skills if they're able to stay at home and be surrounded by things that bring them comfort, be able to get some support in a familiar environment rather than that sterile environment that you'd find in the hospital emergency room. So as long as it's safe to do so, we regularly have clinicians visiting people in their home without the police presence. And that's the bulk of how the BEST team works. But by calling our 800 number and asking for a clinician to come see you at home, typically a response is quoted as being about an hour. Sometimes it's a little better than that, sometimes it's a little longer than that. And so for the police, that's really not a user-friendly time frame. When anyone's having an emergency, an hour feels too long, but certainly we need our first responders to be able to get to as many calls as the public needs. And so if we were to ask a police officer to wait on scene for an hour for one of our clinicians to arrive, that wouldn't be responsive enough, which is how we developed our partnership where we're embedding the clinicians in the police districts. Another great resource that we have that helps us to avoid overutilization of the emergency department and inpatient psychiatric stays is that we have access to community crisis stabilization beds. So these are basically locations where people can get the same level of intervention that they might get on an inpatient locked psychiatric facility. But these are unlocked units where we're able to offer a short-term stay for individuals who are able to partner with us and are voluntarily seeking support to stabilize and then, get back to back home within a short period of time, and that they're able to kind of make some reconnections to existing services, or bridge a brief period of with being without medications. So it is brief, it's not a lengthy stay, but sometimes that is the case with locked psychiatric units as well. So it can be very much of a parallel experience that people might have if they were on a locked unit, but it's only appropriate for people who, where they're safe enough to be in an environment that they're able to stay voluntarily. So those are a lot more resources, and the police are typically trained to know how to utilize. So we find it particularly helpful to have clinicians working alongside officers so that in the moment of a police call, we're able to give some feedback to officers around which of those diversionary options might be helpful to the person in crisis. And then it's up to the police officer as far as, what they think is going to be best in that situation, because we're there as a tool for them. While they often give us quite a lot of latitude to be fairly directive in these calls, we do have to respect that we're working in their environment and that we're only there with them because someone called 911, and that they're ultimately the deciders of what will happen at the end of a call. But as you can see from the services I described through the BEST team, so many of those services are voluntary in nature. We're bringing people to unlocked environments where they're partnering with behavioral health providers, and that they have a voice in what kind of care they're interested in initiating. So even though, sometimes people have an association with the police and all kinds of involuntary things happening to them because we associate police with arrest, through this program, I think the police are able to help kind of reshape a little bit of that line of thinking about how police can be helpful to people who are experiencing behavioral health crisis. So our clinicians, we go with officers to a wide variety of calls, some of those that are coded initially as emotionally disturbed people, but then all kinds of other calls really benefit from having a clinician present. So we find that we are sending clinicians out to family trouble calls, domestic calls, general disturbance, intoxicated persons. Investigate person is kind of an investigate premise, are very broad police terms for, something is going on. Some people are calling 911, but we don't have a lot of detail. And so sometimes those are people in crisis. And so having clinicians available can be helpful. And general affray, also kind of a general call that we find oftentimes is actually a behavioral health need. We find that by having clinicians there with the police, not only are we better serving the needs of the public, but we're also able to introduce people to other alternatives than calling 911. So part of what we do when we're going out and interacting with people in the community is informing people in the community about the BEST team and that we have a 24/7 number and that 911 is not the only option to call if somebody's in need of some behavioral health support. So that's really helpful, so we can free up first responders to get to calls that really require that level of security in response, where many times people call 911 and really some other kind of service could be of use. And we're in the process of partnering with EMS and others throughout the city around some alternative response models that the mayor has endorsed, and that we're, looking to be more creative at how to better send the right responders in when someone is calling 911. So even if you call that number, you won't always be assured to get a police response in the future. Historically, that has been the case. So I think as the national trends indicate, there's greater interest in some of these more creative responses across the country, and we are partners in that kind of work as well. We also, the BEST team is able to do a little bit more in terms of follow-up after crises. So our clinicians working with the police do this. Other parts of the BEST team are able to do this as well. Youth that have any contact with the BEST team have the ability to be followed by our team for as long as 7 days, because we know sometimes situations with youth can be more complicated and potentially more there can be more influence to change things over the course of hours and days. So we provide ongoing support for an extended period of time. And another benefit of having our clinicians with the police is that we're able to model some skills that we might use in different ways than the police are always trained around. So we might both be experts in de-escalation, but a clinician might do that same task in a different way than an officer might be trained to. So being able to go to some chaotic scenes with officers and show them through our own work a different way to approach people in crisis has been received as very helpful by officers. And also, officers are often at chaotic scenes where they're asked to do quite a lot in a short period of time, and they never really hear about the outcomes for people. And so our program really has the ability to close that communication loop with officers and to provide them positive feedback for some of the encounters that they're having in the community, where their assistance in helping people navigate the behavioral health system has led to improved outcomes for that individual. And so that's been really, I think, well received by officers. They give us a lot of positive feedback that they appreciate hearing that their intervention with somebody has led to them utilizing some services and becoming more stable. And some of that happens because our clinicians are effectively communicating across systems. Our systems don't talk to each other very well. So officers don't always know who to communicate with in a hospital when they're sending someone to an emergency room. Vice versa, hospitals don't know how to reach out to officers who may have had contact with a person in crisis in the community. So our partnership really tries to bridge all of that. And we have quite a history. We've been doing this work together since 2010. We started an e-learning curriculum with officers way back then to teach them about these walk-in clinics that we serve. Many people from the public, most of the time people are self-referring and walking in on their own to these urgent care clinics, but there's no reason that the police can't be bringing people here as a voluntary drop-off and just providing that transportation. So for over 10 years, we've been doing training with officers around how to utilize the services that BEST offers. And then since 2011, that's the first time we had a clinician embedded with Boston Police. We've expanded steadily over the years. We had initially started a program with funding through the Department of Mental Health. We've then expanded through some federal grants, and now thankfully are operating out of a line item in the Boston Police budget that comes through City Hall, and we've diverted some funds from police overtime to allow for our expansion, so that now we have a clinician in every single district across the city, at least one. So we provide services alongside the police Monday through Friday from 7:30 in the morning till 11 o'clock at night, and 10 a.m. to 6 p.m. on weekends. So much better than back in 2011 when we had just one clinician for the whole city. Here's some photos of our staff and the work that we do alongside officers. So We see people from juveniles to geriatrics. We provide some unusual kinds of interventions with the police. We're part of their hostage negotiation team to help people who are in crisis who might be barricaded. Sometimes it's not that there's actually a hostage. It might just be that the person themselves is barricaded and unsafe. Sometimes we are dealing with issues of community trauma, victims of traumatic incidents, all different kinds of issues. And just so you can have a visual of what how this all unfolds, at the beginning of a shift, a clinician is paired with an officer, and the dispatchers at the 911 call taking area are notified of where the clinicians are in the city. Our clinician rides with their officer in the cruiser throughout the shift. They're listening on the radio to see if any of these more obvious behavioral health emergency calls come in that they can offer themselves up to go and assist officers on scene. Sometimes other officers get to the scene first and then can request the clinician. And sometimes our clinician is tied up because they're with an officer who's doing some unrelated kind of call. We don't have dedicated mental health response cars in the city. So it might be that the officer is on a traffic stop or dealing with some other kind of a call, and our clinician might be tied up at the time that they might be needed elsewhere in the city. So our clinicians are listening on the radio, and they're able to communicate with officers on different calls over the police radio. So some of the work that they're doing can be done at a distance, working over the phone and the radio to help officers and make sure that they can cover as many calls during their shifts as possible. Once on scene or intervening by phone or radio, it's really up to the officer and the clinician to kind of collaborate and make some of those determinations of what is the priority here. Is this more of a case for diversion to mental health services or more of a criminal matter? And then once that decision's made, the person's either transported somewhere or de-escalated on scene and left there. Sometimes we have our mobile clinicians come and follow up without the police. We can employ different kinds of referrals from the scene to help be less disruptive and keep that person in their environment. And then there are times where people are arrested, and we can then continue to provide some interventions and support for people when they are in police custody. But then that call is closed, and then we move on to the next. So we're really working to kind of triage things very quickly in the community, and then pass those cases that need ongoing behavioral health intervention onto other parts of our BEST system in order to be able to move on to the next case to support the police on the next call. So for those of you who are interested in this subject and are wondering how helpful these co-response programs really are, there are some studies out there with some data that show that these are very cost-effective responses. Both police and people in crisis tend to report positive experiences with these kinds of shared responses. Many times this helps with that communication from what's happening in the community to staff in a hospital environment when hospitalization can't be avoided for a person. We're able to really keep the individual in crisis in the driver's seat more often because our clinicians are better able to navigate some of those voluntary resources rather than overly relying on taking people to the hospital involuntarily.
This is Wes, just giving you a 3-minute warning.
Thank you.
Yeah, we're just looking, we're keeping an eye on the time, sorry.
Sure.
Thank you.
And a lot of these calls lead to officer injury, so the more that we can help de-escalate on scene, the less that individuals in crisis and officers are going to be injured on these kinds of calls. So that was really my last slide. So maybe we can reserve these last few minutes. I want to give Kat a chance to respond to any of your calls. She's out there day in and day out responding to these calls with officers. So I defer to Wes, but I'd be more than happy to have us answer any questions if this is a good time for that.
Yes, this is Wes. Sure, I think we probably have about 2 minutes. If someone's got a question, you can probably respond to that.
Hi, this is Paul. I have a question. Well, I just want to say thank you. Actually, the questions I had, you answered thoroughly. And what it basically was some sort of psychiatric help at the hospitals, but you provided plenty of information and numbers to call, which is great. I just want to thank you for your time. It was very thorough and understanding.
Great, thank you, Paul. Charlie, I see your hand is raised.
Hi, thank you for the comprehensive presentation and also the workflow. That was very helpful to understanding how this works. My question is the BEST team also called in when you're dealing with crises with young people and minors? And then also, does the BEST team collaborate or train or work with any of the resource officers in Boston Police Department that cross over into Boston Public Schools?
Yes, and why don't I turn it over to Kat so she can chime in and share a little bit about her experience.
Real quick, before she starts, I know, Charlie, that this is Paul again. We are working on having someone from Boston School speak in 2023. I just want to lead off with that. Sorry to interrupt.
No problem at all. So yes, we do respond to minors and youth and young adults. A lot of times those can come in as family trouble calls. We've had parents that have different concerns like mental health concerns or things going on in school, things like that. A lot of times, sometimes what happens in that call depends on the parent. So occasionally, it doesn't happen very often, but occasionally we might be responding to a child or a teenager who is very upset, who is breaking things, who is screaming, and we might be able to get the child to calm down and make a safety plan in place, but sometimes a parent says that they're more comfortable with them going to the hospital and getting evaluated. So occasionally that does happen just because they have guardianship and they can make that decision. But a lot of the time we can still connect the family to services. We can connect them with a mobile clinician that will sit down and have a more calm evaluation with the child, and the parent or even the siblings can be involved if they're all going to be home. So we do definitely work out with that. And we occasionally will get calls from schools. There's been a lot of changes with that, with public schools not wanting uniformed Boston police to be inside the school building. So sometimes we'll get into little hairy situations with that, but a lot of the time they will still be calling, asking for help, and we can be there on scene. We can de-escalate, we can see what the safety plan is, we can bring in parents. So we do respond to those calls as much as possible. And what was the second question? I know there was something else you had mentioned.
No, you had covered both of them. It was
perfect.
Yes, so thank you very much.
Yeah, no problem.
We have had a clinician embedded with the school police in the past, but it was a little bit short-lived because there were varying levels of comfort having the officers in the schools, but that's being revisited now. So very likely we might have another opportunity to embed a clinician with the school police in the future. And I see Elizabeth's hand up, but I want to respect the time frame as well. I defer to you, Wes, so let me know.
This is Wes.
I see in the chat it says Elizabeth and then wrap up.
Yes, Elizabeth.
Okay,
With your
great.
question. Last question.
This is Elizabeth Dinkler. Yes, thank you for an excellent presentation. I had, to try and make this quick, do other groups hear your presentations, such as medical school students or other people who are still students in training going into various health professions, but it would be helpful for them to know about it as part of their training? And then that's the second question that's more directly related to your presentation is, do you find that having the clinician on site helps with things like having to use fewer restraints on people with behavioral issues.
I can share, I'll try to tackle the first part and then maybe about the restraints in your experience, Kat, I'll turn that part to you. I can tell you that so BEST works out of the Boston Medical Center Department of Psychiatry, and so we are affiliated with the Boston University Medical School, and people in our leadership work with the medical school and are part of faculty. So there's some explanation, at least in that environment, around emergency services, diversion from police encounters, but truly it's a kind of a niche field, and there isn't as much understanding that we're really even out there as I wish that there were. So feel free, any of you who want to, extend this invitation out there to people that you think could benefit from hearing more about this programming. We do this work right in Boston in partnership with Boston Police, but there are co-responder programs and other mental health collaborations with police departments in various communities throughout Massachusetts. So I think each little community is getting a little bit of press, but if you could know on a larger scale what's going on in partnerships like this, I think it is kind of a heartening situation, better than maybe people might envision, because we do great work in secret sometimes, unfortunately. Kat, do you want to address your perception of around kind of the restraint piece and involuntary piece?
Yeah, sure. So I think it does help having a clinician on board for several reasons. One, when we're going in, especially if it's somebody that's known to us, if we've met with this person before, or if we can look in the BEST record and see some history there, we can kind of look out for anyone who has a history of being aggressive with anyone or of any particular diagnosis. We don't share specific things because of HIPAA, but we can kind of set the framework for the scene we're going to say, this person has a little bit of a history of getting handsy, so we might want to maybe not overcrowd them. Maybe we want to look at not having so many people around. Maybe we only need 2 officers to be in the room as opposed to 5. We can definitely kind of help with that setup. And then in terms of anyone who does need to go to the hospital and they really are not interested in doing that, we're able to assist officers with giving choice and helping people to kind of relax a little bit more in terms of going. So we can talk about hospital choice. If there's a hospital you're more comfortable with, we can do that. We can talk about saying, we really do need to get you to be evaluated, but we don't want to, put hands on you and put you in. So if you're willing to just walk with us, a lot of times clinician, myself included, will offer to ride in the ambulance with people, just so that way they're a little bit more comfortable, so they can continue talking when they're going to the ambulance. So it definitely has helped eliminate going hands-on. And to be perfectly honest, officers really don't want to. These calls, we've seen a lot of officers kind of understand that people are in crisis and they're having a really difficult time, and they really want to avoid restraints as much as possible. So working on these calls together has really been helpful for that.
Okay, thank you, because I was also thinking of the situation where some people, due to past trauma, some people on the autism spectrum, et cetera, might have unusual sensitivity to being touched. So, but thank you for...
Elizabeth, we also do training for police officers, and we do cover trauma, and BPD specifically has really strong autism trainers from within, officers who have loved ones with autism and speak from a lot of personal experience as well as their professional knowledge. So there's quite a bit on the training end outside of just the expertise that our clinicians bring to those calls, and we partner with them around that as well.
Okay, thanks to you both, and thanks for the extra time, Wes.
Okay.
Hi, this is Andrea. Yep, thank you again on behalf of all of us. It's a joy to work with you. Also for the board to know that Chris Morosky in our office sits on an advisory committee related to BEST, so we do have representation with, he knows Lauren quite well. So it's a pleasure to finally meet you myself. And thank you for your time. I will move now to Wes's board report, which he has sent to me. Sorry, let me just make sure we have everyone who needs to be pinned. Okay. Quick board report from Wes that I will read out as he's written. The captioning ordinance has passed with all of the city councilors approving it, and Mayor Wu has signed this into law yesterday. I cannot believe that it is finally done and that it took about 2.5 years to get this done. Because I'm out of town at the moment, I was able to meet with Mayor Wu recently with Commissioner McCosh for a photo op, and we had a great chat with Mayor Wu. She thanked me and the commission for pushing this effort, as she knows that this is a big equity issue and that we have a lot of barriers when it comes to equity and belonging. Second, I would like to make a shout out to Sheila Shu, a deaf local who is currently doing graduate school at Harvard University for a complete mission up in space through the Astro Access program, which can be found at astroaccess.org. This is a special program for disabled people to get up in space. Astro Access is dedicated to advancing disability inclusion in space exploration, not just for the benefits of marginalized communities, but for the benefit of all humankind. This project is part of a new reality where disabled astronauts not only exist, but are crew members to the mission of going out in space regardless of their disability. All right, I have some sad news to share. Thanks to Jerry for bringing this up to my attention. David Vieira passed away this past July. As many of us know, he was a staunch advocate at several advisory board meetings, including for the Bike Safety Awareness Campaign. David had been sick for a long time, and per the commissioner, to honor David's advocacy, she has been in touch with folks at the Boston Public Library about a recognition related to the accessibility upgrades at the Copley branch, as they have known him for several years of volunteer work with the Friends of the Boston Public Library. As I have known him for a very short time in the past 4 years, I would like to commemorate his passing, and before I open to the advisory board for any remarks or thoughts that everyone would like to share on David, let's please have a moment of silence for David's passing. Thank you. Who would like to share comments or memories that you may have about David?
Hi, it's Kristen McCosh. I'd like to share one piece of information. Thank you, Wes, for bringing this up. It was very sad news when we heard it over the summer. David was a great advocate. Another way we're planning to honor him is part of our bike outreach campaign, which I'll talk a little bit about in my report. But David was also a staunch advocate for safety on public rights of way in Boston, particularly where it concerns Boston bikes, cyclists, people who rent the bikes, people who ride bikes. So he had really advocated for that safety program for a long time. So we had some grant funding, and we finally have the initiative ready to go, and we will also put a note in that to memorialize David and thank him for his advocacy.
This is Carl. If I may say a word or two. Can I go ahead? What? Okay. So, while most of us here know David as a strong advocate for the library and pedestrian safety in terms of bicycling and sidewalk use, many of us may not know that David was also a huge animal lover. So when the blind community would get together and have some sporting events such as beat ball or something, occasionally David would babysit all the guide dogs and keep track of them so that the blind community could go out and do some other things. So he was a dog lover as well. And anybody in my book that's a dog lover is a great humanitarian.
It's Elizabeth. Did you want me to just go ahead?
This is Andrea. Wes indicated in the chat that he would like Jerry to go after Carl, then you, Elizabeth.
Oh, sorry, I couldn't remember the order.
That's okay.
Thank you. This is Jerry. Yes, I just remember David primarily from, coming to our monthly meetings faithfully when, particularly when I was chair. And he always had public comment, and he always participated fully in the meetings, and I was very, very impressed with that. And I was lucky enough to see David on our commutes, shared commutes occasionally. As he lived in Hyde Park and I lived in West Roxbury, not too far. And I was just very impressed by David and his commitment to the city and his commitment and his advocacy, for people with disabilities and also the library as well. And, just from talking with David, he had worked for the city for a long time as well. So he remained committed to the city even after his professional career with the city had ended, and that's to be commended. And definitely, however, we could commemorate David's and memorialize David. I think is more than appropriate. So, thank you.
Yes, it's Elizabeth. Thank you for these other remembrances about David and Carl. That isn't an aspect of David I had known about with his being a dog lover, an animal lover. I only knew him in the context of his attendance at our meetings, but as Jerry had noted, that his attendance in person when we were meeting in person, and then on our online Zoom calls, that he certainly was tireless in his advocacy. That staunch is certainly one of the descriptors that come to mind, but also, his sense is the sense of passion and urgency and safety issues that he raised are ones that come to mind, and I think that that is fitting that there will be these ways to with bicycle safety or the library entrance, that there'll be ways to commemorate his ongoing tireless work for those. Thank you.
This is Andrea, so I'll read out Wes's message from the chat. I appreciate all for sharing your thoughts on David. He will be missed. All right, since we already had Alice as our advisory board member spotlight, we will move forward to the commissioner's report.
Thanks, Wes. And Andrea will be sharing slides. right, great. So I don't have a very long report tonight, just a few things to go over. So first of all, we'll start with some city initiatives. As Wes mentioned, and you all know by now, the captions ordinance passed this month. Mayor Wu has signed it into law, and it's in effect right now. We had the celebratory signing event this week with the press conference. It's been on the news, it's been in the newspaper, so hopefully you've all got to read about it. So now, starting in the new year, we will work with our city department partners and the community to get the word out. We're going to be producing some materials for information, and one of the things that we're thinking about is a little wallet-sized card that we can give out to residents just so that they can show the information to a business owner. If they don't know about the ordinance, it will be a real simple requirement card that you can all show, and hopefully it will help to educate businesses about this requirement. So looking forward to the new year and when we can start doing outreach, and really looking forward to getting out there and seeing the captions on all these TVs. Many thanks again to Wes for all his advocacy, and I can say this is definitely one of the biggest accomplishments that the board has made ever, and so really proud of all your work, and like I said, looking forward to seeing this in action. The next initiative that we're working on is with the Boston Public Schools. Mayor Wu has announced a Green New Deal for the Boston Public Schools. This is a commitment to tackle both inequality and climate change through investments that include reducing greenhouse gas, creating high-paying jobs, improving community resilience, ensuring clean air, water, and healthy food. So we are involved on the team looking at buildings. We know that BPS has a lot of very old buildings. They've also begun to build new schools in the last few years, which it had been decades since that had happened, so that's good news. But we are working with different consultants who are already on board working on this project. One of them is doing an ADA assessment of all the existing buildings, and another one is working on looking forward. So they are working with us to create a series of engagement sessions for the community to talk about what their future vision is for the schools as far as buildings, but teaching and learning, what your priorities are. So we'll be organizing a listening session, engagement session in January, dedicated just for disability concerns, but there will also be several others throughout the city in January and February. So I would encourage anybody who's interested to attend, not just the disability-focused session, but all the sessions or any that are convenient for you. And we'll have much more information on that coming up. Next slide. So just a note about the state ethics training. The Mass Inspector General holds these a few times a year. You all know that you're considered special employees of the City of Boston, and so you're held accountable to the ethics standards. I know some of you are already taken this training, and there is a small fee, but we can reimburse you if you do participate. And there are a few more, there'll be several sessions coming up in the new year, so please think about attending that. And then the new board schedule is out for 2023. The meetings will remain virtual at least through March, and we'll keep you updated if they return to in-person in 2023. Everyone should have received the calendar invites, but these are the following days. I won't read all the dates, but they are in the email that we sent, and we can follow up with sending my report. But just so everybody knows, they will continue to be on Wednesdays. We can't have it on a regular Wednesday, like the second or third Wednesday every month, because of conflicting cable schedules. But they're never pretty much the first Wednesday, so a particular Wednesday every month. And we look forward to everybody joining. Next slide. And then just some updates on the advisory board. For new members, in case you're not aware, we do hold elections every year for the role of chair, vice chair, secretary, and treasurer. So we will be holding these in the new year. We will ask for nominations in January, and we will schedule the votes in February. All members are eligible to serve on the committee the executive committee. And we encourage anybody who's interested to nominate themselves. And we've had different processes in the past for, we've done like roll call nominations, we've done, self-identifying nominations. So Andrea can talk through the process with the executive committee in January, and then we'll talk through it at the board meeting just to see how we'll hold the election. But I would encourage everybody to think about if they're interested in any roles. And I really would just like to thank the board members who are in their current roles because you've done a great job. I can honestly say that this executive committee is the most active we've ever had. And want to give a big shout out to Wes for his leadership because he has done a phenomenal job in really getting the board to not only do some work like you always do, but actually to make some huge accomplishments. So thanks to Wes and the executive committee and the whole board. And we'll talk more in January. And that's it, brief report, but happy to answer questions if anybody has any.
Okay, this is Wes. I'm assuming there's no questions. Seeing none. Jerry, go ahead.
Yes, sorry for the late raise of hand there. I was having trouble finding the button. But Commissioner, as has been discussed in the media and at the press conference around the ordinance, right now it doesn't have any penalties for non-compliance. Have you had good feedback from the business community? What's your sense in terms of compliance? Do you think most businesses either already comply or will comply?
Yeah, it was a little bit the way the media kind of sliced and diced the sound bite. It wasn't quite the full story. So it's not that there's no enforcement, it's just that our office can't do any enforcement. We are listed in the ordinance kind of as like the mitigating department. So we want to work very closely with businesses to help them come into compliance, whether it's just telling them the basic information, like some people are worried that they might have to produce captions. It's nothing like that. Like literally all they have to do is flip on the enable captions feature. So we will provide that information. If they can't find the button, we'll help them do that. But there is enforcement through the licensing board. The city's licensing board gives licenses to all businesses to operate. So if after a certain period of time when we've had discussions with the business, first if we get a complaint about a business, if we have discussions with the business over and over and they're still not willing to comply, we can refer the issue to the licensing board and they can work with them to tell them the importance of the ordinance, that it's actually a law in the city of Boston that they have to comply. And if it comes down to it, they can hold a hearing and their license can be suspended or revoked. So there is definitely enforcement. It's just, we really didn't want to impose a fine because we know that businesses are struggling, especially small businesses. So we didn't want to be punitive off the bat. We wanted to really work collaboratively at first, and then if it becomes necessary, we can do work on enforcement.
This is Andrea. Just want to clarify. Sorry, just want to clarify the license for having the TV in the business can be pulled. We're not going to shut down a restaurant, but they actually have to have a different special license just to have the TV, and that's what could be pulled.
This is Wes. Thank you very much. I also wanted to ask a question myself, especially before my internet goes out again, potentially. Commissioner, my question is, will there be some kind of data analysis that we could review, assessments to see how the captions are going, how compliance is going? Is there any sort of assessment or review planned for maybe next year in terms of looking back and seeing what statistics and information we can gather about the program? How will we assess?
That's a good point. Yep, we can talk about that internally. The second part of the question that was asked was about reactions so far. So our office has received just a few calls, and Really, it was just questions about like information, like what does this mean? Is it in effect now? Somebody asked for a copy of the ordinance. Some people said, one restaurant said, like when we told him that he just has to turn on the closed caption feature, he said, okay, great, with an exclamation point. So we haven't heard any negative feedback, certainly. So I think more now is just getting the information out, and hopefully it won't come to any enforcement in the new year, but we'll work on that. And we can definitely talk about ways to analyze the program, Wes. So that's a good call.
Okay, terrific. I also wanted to add that I found some social media posts and comments from folks in the community who were very excited to see this happening, so I can forward those to the board later. And thanked everybody for their follow through on that. Charlie, go ahead.
I just wanted to comment on how quickly I had seen closed captioning. This morning I went to my gym at 6 a.m. and all the TVs had closed captioning on already. But the interesting thing is that it's in a hotel, a prominent hotel, and the executives, the management executives there are also there, and they were talking about it just around reminding all the other folks to do that. And they said that an email circulated. So I was listening and kind of asked them about it and then introduced myself. But it sounds like people are taking it seriously and they understand the importance of it. But then it is something, the comment that came, they had asked me and they said, so why is it taking so long for something so easy as pressing a button to turn on? And I didn't really have a strong answer for it, but I did thank them that they found out very quickly and started making sure that that all their management people knew to comply.
That's really exciting to hear. Thank you for that feedback.
Wes, I have a question.
Sorry, for the interpreter, who's speaking?
Yeah, this is Richard Glevsky. My computer keeps freezing, so I'm on the phone.
Sure, Richard, why don't you go ahead? And then we'll have Elizabeth.
So Commissioner, how, in terms of enforcement, what do you think about the idea of asking the public to inform the commission should they observe noncompliance?
Yeah, we really hope to do some outreach to spread the word among the disability community. And yeah, people are always welcome to give us feedback. Our office is listed in the ordinance as the only city office who's, involved with rolling this new law out. So, and we'll be doing a lot of social media outreach. Like I said, we'll be producing some wallet-sized cards that people can carry. The ordinance does mention a complaint process, which is to contact our office. So yeah, we could certainly put out a call for people to get in touch with us to let us know if they've seen it, if it's working, if they know of any places that have not enabled captions. So yeah, I think that's something we can definitely work on, Richard.
Yeah, maybe perhaps even include it in the various notices you send out to the public as a footnote or something. Says words to the effect that there's a new ordinance, requires restaurants and other facilities to comply by having closed captioning, and you should encounter a situation where someone is not compliant, please let us know, and here's how to do that, something like that. Because I think, I think we probably all know, it takes a while for the public, but whatever publicity there may have been about a new ordinance like this, to get it, understand it, and of course, we want people who, not just people who are particularly benefit from closed captioning, but people who don't necessarily need it or are sensitive to the issue to be alert to it, and also to let us know if someone's not complying.
Yeah, we have a whole outreach plan that we'll be launching in 2023, and that will definitely include like the disability community. It will include our city departments. It will include reaching out to the businesses like the hotels Charlie mentioned small businesses on main streets. So yeah, we definitely, we have a staff person who does specifically outreach and engagement, so she'll be working on it too. So yes, those are all great suggestions. Thank you.
Thank you.
This is Wes. I just wanted to add as well, as I put in the chat, you may have noticed that there are, if you do notice any businesses along your travels that are not compliant, please do let us know. And the email address is disability@boston.gov. And we'll have Elizabeth.
Yes, thank you. First, congratulations. It's wonderful news that this is now passed and in effect. And I think that will be very helpful with the outreach, and I imagine that you already include other forums for business roundtables and as well as the different sectors you've mentioned. Regarding the collection of data and analysis, the evaluation of how it's going, two things. Could these reports be made anonymously if someone chose? I know some people, will, for whatever the issue, are concerned about. It doesn't seem like this issue, compared to, just trying to think this through out loud. Compared to other issues, this seems like someone would have less concern about retribution or whatever, but if someone, wanted to call and not have it be through, say, an email, is that an option? As I said, it's not a safety issue like others in one sense, but just to make it as easy as possible for people to report it. And also, is it allowed or possible to know, for instance, when you said, when Andrea clarified that restaurants have separate TV licenses, is it possible to know which places have TVs?
Elizabeth, I think we can look into all those things and circle back. Just in the interest of time, I don't,
Sure.
want to speculate. Okay. Those are great suggestions.
Sure.
Okay, this is Wes. And
We'll
Carl.
go with Carl next, please.
I'm sorry, did you call me?
Yes, Carl, go ahead.
So yes, hi, this is Carl. I just want to let you guys know I printed out the ordinance and I've been sharing it with a number of legislators at the State House, and many of them are very excited, and I'm trying to see if I can get any of them to use this as a template to file potentially a bill to make this a requirement statewide. And so we'll see what happens. We have about 4 weeks to be able to file a bill, and I'm trying to find some legislators that might file a bill and submit it based on Boston's success of signing this ordinance.
This is Wes. Thank you very much. Fingers crossed. Absolutely. If we could get this statewide, that would be very exciting. I think starting with the city of Boston was maybe a good move, because I think it's a little bit of a faster process to get a bill through the legislature at the city level. We're all familiar with that, so we might move on up. Okay, any other comments or questions for the commissioner about her report?
Okay, seeing none. We're going to move to announcements. Does anybody have any announcements to share? I don't have any, but I'm not sure if any other board members have anything they need to announce. Now would be the time. Okay, then I'm going to move on to the next item on the agenda, which is old business. And what I'd like to talk about is the welcome letter to the governor-elect, Governor-elect Maura Healey. And we have a welcome letter. We know that there's been some comments. And I think Richard actually has a comment. Richard, did you want to say something?
Sure, Wes, happy to. So, I don't know about the rest of you, and I'm new to the commission, so apologies if all of this is clear to everyone, but it starts with, in the letter, reminding me of this issues because, and I apologize because I don't have my computer in front of me because I'm frozen out of the meeting. I can't figure out how to get back in other than by calling it. But so I've forgotten how the letter refers to us as a commission. But I've noticed there and in a number of other places, we call ourselves very different things. So, for example, our website calls us the Commission Advisory Board. Emails from official emails refer to us as the City of Boston Disability Commission. There are signature blocks I've seen that refer to us as the Mayor's Commission for Persons with Disabilities. The agenda for today's meeting refers to us as the Disability Commission Advisory Board. So we have a charter, and I don't know how familiar you are with it, but with Wes's help and others, I tracked it down. And our charter says we're the Commission for Persons with Disabilities, or we can be called the Commission on Disabilities. That's what our charter, as I understand it, says. And it also has other languages, including it says we only have 9 members, yet we have 13. So my first issue with the letter is that it.
Yes,
I don't
actually,
think it
Richard, I understand where this is coming from, and I'm just going to ask Andrea to sort of make a clarification about, let's make a clarification about what our role is. Could you, Andrea?
Thanks, Wes. And yeah, maybe we should connect offline because I can imagine where you're coming from a legal perspective. Basically, the state law and the city ordinance that create the department that I work for and the entity on which you serve are very confusing and contradict each other. So our office was created before the state created commissions on disability. So we got the title commission before that happened. Then the state created them for every municipality in your function, but sort of we already had the title. So you were on the entity created by 8J, Commission on Disability. There used to be only 9 members. That was extended under state law, although the bylaws haven't updated to reflect that. So we've called you the advisory board to try and keep that separate because under city ordinance, we're the commission, but under state law, you're the commission. So we refer to our department of full-time staff appointed by the mayor to get benefits and come to City Hall every day, the commission. And we call you all the advisory board to try and keep that separate. But you're right, under state law, you're a commission. So
I have a little more clarification to add too. Hi, it's Kristen McCosh. So Richard, another thing about that is when I was appointed as commissioner in 2010, the Commission Advisory Board had just been established in 2009, just before I was appointed as commissioner. So we did have a commission way back when after the office was established in like the 80s, but it hadn't met for a long time. So the City Council approved accepting Mass Chapter 40, Section 8J, which is the legislation that Andrea referred to. And that did call for 9 members. But then after I was on board a few years, we really wanted to get more representation of different neighborhoods and disabilities and ethnicities. So we had the state legislation amended to 13 members. But also the reason for the advisory board was worked out under Mayor Thomas Menino when I worked with him, because he wanted to be very clear that the advisory board didn't oversee the office, because Andrea said they can seem contradictory, and some commissions have oversight over offices, like the Boston School Committee has oversight over the school department to some extent, and like the historical commissions have oversight over city departments and city laws, but the advisory board doesn't have any oversight or enforcement powers. So the mayor at the time wanted to be very clear that the commission is the commission, and we do our work, and the advisory board is part of 8J, but it's but it's an advisory board to our office. So that's the distinction between commission and advisory board.
So, I have to confess, and maybe it's just my shortcoming, I'm still confused. If it's permissible in the open meeting law to take this offline, I'm happy to do it.
This is,
All I know is we have
Wes,
a charter.
this is Wes here. I'm sorry, I'm going to interrupt for one moment. I actually have been confused by this issue myself. And I do want to add, like I said, that I've been confused. There's been a lot of confusion about the names. And because as you said, the bylaws show some different wording. And so I think that actually is something that I had on my list under new business to talk about this. But I want to get back to the issue, the point about the governor welcoming the governor-elect. Are there any comments related to the governor-elect letter? So if I could bring us back to
Sure,
that.
so if I could just go from there. I apologize for being blunt. I don't mean to offend anyone, but I don't think it was a terribly well-written letter. And I think it had a bunch of errors in it. I have marked it up with the changes I think should be made and an explanation why. It would honestly take me some time to go through it in this meeting, and I can't, and I don't have it in front of me anyway because my computer's frozen. But
Okay.
I think it needs.
All right, that's completely fine. What I'd like you to do then, why don't you go ahead and send me your suggested edits, and then Andrea and I will take a look at those suggested edits, and we can work together to update the version of the letter.
Sure, happy to send them to you as soon as I'm unfrozen.
This is Andrea.
Great, that's great, thank you. Anyone else on the board have anything to say or any comment related to the letter? Andrea, did you want to take the floor? Did you have something?
I just wanted to note that means our January 18th meeting would be the one where we would vote to approve and send. So it will be after the inauguration. We may want to update a sentence that says, congrats on not just your election, but taking office.
Wes says yes, that's fine. Yeah, that will work out. Jerry,
Yes, if you don't mind. Thank you, Wes. And thank you for your feedback, Richard. I would hope, because letters like this have been delayed in the past because, we have, as a board, we have, as a board, gone back and forth a lot. So I would really hope that, whatever edits, suffice now, that we could come up with a process where we could get, letters like this one out as quickly as possible. I was really hoping that any edits or whatnot would go through the executive committee. That's what, and I thought we had given everyone, and Andrea had sent the letter out last week and had given, folks what I thought was ample time to provide feedback and funnel it through the executive board. So maybe at some point in a future meeting, we can really come up with a process and streamline the process.
This is Andrea. The one challenge to that model is that under the open meeting law, any content can only be discussed at a publicly noticed meeting. So the executive committee meetings aren't publicly noticed. We only use them to discuss process and what's on the agenda for the next meeting and who we're going to invite, things like that. Any content of an opinion the board might express would have to be discussed either at this monthly meeting, or if we want, we can publicly notice. We need 48 hours. We can publicly notice the executive committee meetings and record them. We don't necessarily have to broadcast them on cable. That's not required. We just do that because we want people to access this meeting, as long as we record it and provide the recording to anyone who asks, and let anyone in who wants to attend. In theory, we could have those executive committees meetings be open and discuss content.
Sure, I wasn't aware, of the the open meeting law would apply.
It's very strict.
Situations like this. I would just hope that we could come up with a streamlined process so letters like this go out as efficiently and as timely as possible. So.
Hi, it's Kristen McCosh, just to jump in. Jerry, I think you raise a really good point. I think, like Andrea is mentioning, we can't go over content in an executive committee meeting, but I think it's a great idea to come up with a process. Like, certain people will offer to write a draft, and then it will go to the whole board, then it will go to the executive committee, and they're given like a week to make edits, or whatever you decide the process to be. But I agree, I think that's a great idea.
Okay, this is Wes. I'm going to add that, I'll actually add this to the executive committee meeting so that we can talk a little about getting it in the plan to talk about this in one of our upcoming meetings. And then I think it would be helpful for us to also discuss who next presenters would be as well. But I think, and I'm also open, we're open to any suggestions if people would like to see specific presenters. Okay. Any additional questions about the letter for welcoming Governor-elect Healy? If not, then what we'll do is we'll get some comment from Richard, and then we can share that edited draft for comment. Okay, and that'll be our process, right, Andrea?
Yes, if Richard sends his suggested edits to you, we can distribute the updated letter to the board for a vote in January.
Okay, great. Yeah, that sounds like a plan. Thank you. Okay, let's see. Moving on to the next item on the agenda, which is the board bylaws, which we've actually somewhat covered a little bit of that because we've had a bit of a discussion. We mixed our discussions, and I do know that both Andrea and the commissioner had spoken about the confusion about the language of the advisory board, and so basically the language that in the state that refers to us is different from sort of what we're really doing. So the bylaws actually have to reflect what the structure really is, and the bylaws are a bit outdated. So part of the new business, what I would like to do is I'd like to make a recommendation that the executive committee take a look at the bylaws and see what changes that have been occurring since the advisory has been established. And I think that it would be helpful to make some revisions, or like to make some suggested revisions on the bylaws to make sure that it's something that reflects what we're doing, and it's using standard language to reflect what we're doing. So what do people think about that? So I'm opening the floor to any thoughts on this for dealing with the bylaws being outdated. And I see Olivia. Olivia, I see that you have a hand raised.
Yeah, I almost think this should be its own public meeting. Where we can discuss content, make votes, and do the work to actually change the bylaws themselves.
This is Andrea. We could decide today to hold a special meeting to discuss just the bylaws. Can be whatever length of time you want, as long as I have 48 hours to put a public notice on boston.gov. That's the plan.
Wes says, okay, sure. We could, maybe after the new year, have a special meeting. Okay.
Wes, this is Dick Levsky. I think that's a good idea. Because my sense is various members of the commission would have different thoughts about it. I don't know who's looked at the bylaws recently or not, but I think if you haven't, you'd find them interesting, and perhaps it would sort of underscore the need for them to be provide, and you may have some ideas. I think highly likely any of the commissioners may have some ideas about them.
Okay. This is Wes.
Do I need to make a motion? This is
Sorry.
Olivia.
I'm sorry, can people see me? Wes,
Yeah.
I can be seen. I'm sorry, my screen froze and I was not sure if I was being seen. So I think I might have missed the last part of your comment, Dick.
I was just saying, it strikes me as a good idea to have a public meeting on the issue for a number of reasons. One, it's kind of important, but two, I think
Okay,
it's
great.
a very good chance that each of the commissioners might have some thoughts after they've looked at the bylaws, and maybe all of the commissioners are familiar with them, maybe they're not.
Okay, great. So, Andrea, I don't think I've ever been around to call a special meeting. So, in order to set up a special meeting, is that something that I need to, I guess maybe, do I need to ask Andrea and Commissioner, would you be able to assist with the steps for doing this? Assist me with that?
And this is Andrea, absolutely. I don't believe there are any particular, you don't need to take a vote or establish a committee. I don't believe you have to do anything like that. You and I can just connect offline about the date and time that you want it to be, and then we'll get it publicly noticed and send the link to everybody.
Hi, it's the commissioner. I think we should give a little bit of time just so we can send out the materials. Like Dick mentioned, there are a bunch of different documents and some supersede others. There is a charter for our department in City Hall. There is state legislation for disability commissions. And there's, some revisions to the state law. And then also there is just some background that I can give everybody, like similar to what I said earlier. But also we're meeting with the law department to try to get clarity. So I would suggest scheduling the meeting a little bit out so that we can have time to do this research before. But if you actually read the bylaws, they do say that with a certain number of votes that the board can change the bylaws. So I would recommend everybody read them before the next meeting and or before this special meeting. Thank you.
Very well. Okay, thank you very much, Commissioner.
Sorry to interrupt again, but I think, Commissioner, if somebody could send around the bylaws so everybody has them. I don't know that everybody does. And we might want to have somebody from the law department join us at the meeting if it appears that, there are going to be legal issues that sound like maybe kind of complicated.
Okay, Mrs. West. Andrea, do you have a response to that?
I was just going to say that the Assistant Corporation Counsel dedicated to boards and commissions has recently left, so I know that position is empty. So to Commissioner's point about just needing some time to get the right expertise in the room.
Okay, this is Wes. I do see another hand up, and I think this is going to be our last comment because we want to leave time for public input. Okay, so Jerry, I think you have a comment. I see your hand.
Yes, thank you, Wes. And I will make this short. When we did discuss drafting a letter to Governor-elect Healy, we also discussed drafting a similar letter to incoming Attorney General Campbell. I was unable to work on that draft, so that's why I didn't forward anything over to Andrea or to you, Wes, to look at. But that is another piece of old business that we had discussed and said that we would work on. So again, coming up with the process and whatnot, I think is paramount.
Okay. Thank you very much, Jerry, for that. I think Elizabeth had her hand up. If we could just, is it short or is it short enough that we can actually move forward for public input? Is that all right if we move to public input?
Yes, it wasn't a comment, it was an announcement, and that can go out separately.
Oh. Okay, no, then go ahead with the announcement if it's short. Go ahead with the announcement, Elizabeth. I'll give you a minute to do that, and then we'll move to public input.
Sorry, I was just having trouble with mute. The RTAG, Riders Transportation Access Group, will be having, there's a meeting that was originally going to take place in November and has had to be bumped along. It will take place in late January about safety and communication involving ride vehicles, and I believe that's going to be Thursday the 26th at 5:30 p.m. I'll double check that because I see it's not posted on the website of RTAG's website at the moment, but it is a meeting I've mentioned before. It will be happening at the end of January. And anyone who's involved in the November 11th issues that happened, I know feels the concerns.
This is Wes. Elizabeth, thank you very much. We appreciate that. Okay. So I know we have we have members here, we have officers here as well. We've been through our agenda, and so we have public input, and we have opened the floor at this point to see if there are any comments or questions from the public. Please feel free to raise your hand. Jim Elliott, go ahead.
Hi, thank you for giving me time. I want to just share our experience with Boston Public School transportation and issues. We've had, my name is Jim Elliott. I'm the parent of a 4-year-old daughter with spina bifida, a neurological tube defect that affects her mobility, bowel, and bladder functions, and other systems. Because of her limited use of legs below the hips, Josephine is a full-time wheelchair user, and she also needs to be catheterized every 3 to 4 hours. JoJo was placed at the Josiah Quincy Elementary School in Chinatown during her transition to BPS from early intervention December of 2021, and as guaranteed door-to-door transportation in her individualized education plan. This is a service that our family depends on to safely get our daughter to and from our home in Roslindale on the daily basis. We love her placement at JQES. Teachers have been wonderful. Nursing staff is very attentive, and Josephine welcomes with multiple trips she must take with the nurses each day, and her occupational and physical therapists have all been great. But since April break of 2022, Josephine's afternoon bus service has intermediately been without a driver to cover her route. This is due to the process of how the bus routes are covered. From our understanding, if a bus route is uncovered, the route goes out to bid to the other bus drivers. If the route does not get a bid, the options provided to parents, guardians, and to the parents and guardians of the child are to wait and see if transportation department can find another driver willing to pick it up. Or the parents or guardians can pick up their child at their own expense, usually during working hours, or call the transportation department's line to report the child as a stranded student at school. And then the transportation department will assign a driver after all of the covered routes are completed, meaning their pickup from school could be as late as 6:30 p.m. This whole process has caused and continues to cause many issues for families and special education students like our daughter. I would like to present the issues that our family has had to deal with within her first year in BPS. Overall, we've had an abhorrent communications with Boston Public Schools at a system level. When our daughter's bus is uncovered, we receive an automated text letting us know that the route is uncovered. We have received this text anywhere between 1:30 p.m. and as late as 3:08 p.m. The pre-K classes in her school dismiss at 3:45 p.m. As a family of 2 working parents with a second child in daycare, and Joe attending school that is 35 minutes away without traffic, this makes planning very difficult, as we need to quickly make proper arrangements with our jobs to pick her up. We have tried to address the transportation department, but when we call the hotline, we have to wait on an average of 45 minutes before we can speak to anyone, and we have to follow up with them multiple times. On the first day of school this year, when we were notified there was no afternoon driver and multiple calls to the transportation department, we did receive a call back. However, that came at 6:30 p.m. asking if our child was home or if she still needed a ride. Please keep in mind that our daughter is 4 years old and with time-sensitive medical needs. A driver was eventually assigned to JoJo's bus route, but only after we had to escalate the case through the chain of command, including speaking with the Assistant Superintendent of Special Education, Director of Transportation, the BPS Ombudswoman, and eventually Superintendent Mary Skipper on her first week on the job. This inconsistency affects our daughters in numerous ways. Emotionally, the inconsistency of her transportation arrangements confuses our daughter and causes her to get emotional at dismissal, as she does not know how she's getting home. And this is not just for one day, but has gone on for weeks at a time causing her to cry while waiting for bus and at home. This also affects her bowel and bladder management process. The latest she's catheterized at school is 3:30 p.m., and on a normal day, she will be home around 5 p.m. The nursing staff is contractually required to be dismissed at 4:30 p.m., whether there are students waiting at her school or not. Our daughter has had to wait if our daughter has to wait due to a delay on getting a bus covered, it eats into that 3-hour window between catheterizations. If she's not catheterized, she can cause a slew of health problems, including UTIs and kidney issues. Recent testing revealed scarring in both kidneys, which makes consistency in her catheterization schedule even more important. She's also on a bowel regimen, which takes over an hour every other night, and delays in her transportation affect this timing, as well as delaying her dinner and cutting into her time with family. Since the beginning of this academic year, we have run into 2 new safety issues. The first has been at least twice the driver that's filling in for the normal driver did not know how to use the wheelchair lift on her bus. The first time, the monitor had to push our daughter in her wheelchair out the back door to me and the driver, and we had to lower her to the ground. Then the second time this happened,
I'm sorry to interrupt, Jim. This is Wes. I'm sorry to interrupt you. I really apologize. This is very compelling and important. Unfortunately, our meeting ends at 7:30. So I really appreciate you sharing all of your comments. It's very important to us. On behalf of the commission and the board, we're very interested in hearing about this. It's a very important issue. And we know that it's kind of a mess. You are not the only family who has been affected by the bus driver shortages and what's going on with transportation at BPS. Unfortunately, the mayor's office already has a contract, and the board is aware of this issue. It has been ongoing, and we are very hopeful that with our advocacy, we can hopefully address this and get a new contract for services starting for next year. The board members or the commissioner, do you have anything to add? Again, we really do appreciate your commentary. This is Wes. Jim, I want to thank you so much for coming. Your comments are very, very important to us. It's really just a time issue. Okay.
Hi, it's the commissioner. Can I suggest, Jim, would you like to give me a call or email me your comments and we can talk this through a little bit more? I'll be in the office tomorrow.
Absolutely. Can you send me your email and I can email you the entire speech that I had written up so you can see the other safety issues that have become more relevant, especially at the end of November leading into early December, and there are really important safety issues.
Okay, could you email it to disability@boston.gov? That will come to me. Okay, great. Thank you so much. Like Wes said, we know this is critical, and I'll be happy to talk to you about it.
Great, thank you.
This is Wes. Charlie, I see your hand up. Did you want to say something before we?
Yeah, just really quick. I know that I think it's important that Mr. Elliott submits his comments for public comment, that somebody from the commission follows up with him, because I think the background was specifically to give context around specifically when we talk about disabilities and accessibility. I understand that there's a contract that has to be signed, but I think part of advocacy is educating all departments on what is going on. And second, I think we really need to dig into procedures and timing. We do run over, and I'm new. However, if we do have technical difficulties that run into the time, I think there should be some sort of mechanism. Is it the clock that determines the actual meeting, or is it the actual time that we are working? For instance, this is supposed to be a 2-hour meeting, or an hour and a half. Does that mean that it's an hour and a half even if we have a half hour of technical difficulties or whichever. So I think it's important that we possibly dig into that too, because it seems like we're going to be getting into some pretty big issues coming into the next year and other presenters that would run over time if we're not managing the time properly. Thank you.
This is Wes. Thank you, Charlie. Appreciate you bringing that up. What I would suggest is to add that to new business for the January or February meeting, and think about this issue again in terms of the transportation and the contract that will be coming up at the beginning of the next academic year. So we can certainly add that to new business. And when we do that, hopefully we will get the mayor's attention. Again, on behalf of the board, we appreciate the comments. Carl, I see your hand is raised as well. Again, thinking about time, did you have something you wanted to say?
I think Carl is muted, but I saw his mouth move, so I think he may have made his motion. There you are, Carl, unmuted.
I don't have to be the only one, I know it's my tradition, but I'd like to make a motion to adjourn.
This is Jerry. I will second, but I also
Yes,
think.
I also second.
Yeah.
I want to thank everyone. I want to say happy holidays to you all. We will see you next year. Stay safe and stay healthy. Thank you very much for your time tonight. We are adjourned.
Bye now.